Okay, we'll be getting started as soon as we have more people joining us. Let's see, we have 2 viewers, and please go ahead and write in questions about YouTube with family medicine or emergency medicine, either one. We're still waiting for Dr. Oller to join us. And I'm looking for him. See if he's in the chat. No. Looking for Q&A. No. All right. So thank you for your patience as we wait for Dr. Oller to join us. Let me see if maybe he's trying to reach me on my email. And here, I'm online and waiting. I'm not sure I'm in the right place. Well, we'll send you another invitation then. So I'll do that right now. I'll send it to TheEDexitVideo. TheEDexitVideo. There we go. Invitation was posted, and I'll also send it to your personal one, just in case that works better. There we go. All right, so check again. There you are. All right. So let me get the control room out here so we can adjust this. There you are. Now you're full screen.
Excellent.
Welcome, Dr. Oller. We're glad to have you be a part of our Google Hangout on air.
Thank you, Dr. Vaughan. It's my pleasure to be here and to get to meet you online.
Yeah.
So I'm very glad you reached out.
Yeah, I'm glad that to find another physician who's putting educational material on, and very interesting material on YouTube.
Yes, sir.
I see that we both had a video last week on toenail removal, or let's see, I guess mine actually came out yesterday. I don't know if you caught that or not.
Not yet.
I was checking really quickly just to see if it was indeed yesterday the mine went out, and yes, it was 20 hours ago it went live. It's actually a procedure that's done both in the emergency department and in family medicine. Ours are a little more scheduled, and when somebody has a primary care doctor who can do it, they can go ahead and come in and do it. I believe yours was more of an emergency case, though. Is that correct?
Well, you know, pseudo emergencies. 80% of what we do is unscheduled procedures. You know, they're not really emergencies, but the patient presented because she had the problem with the nail for a long time, but then she walked into a piece of furniture and partially avulsed the nail, and it was hurting a lot, so she needed out right then and there.
And oftentimes they'll happen that way. Other times it'll be like mine was an ingrown toenail where it's just smoldering sometimes for months before a person will come in and get taken care of. But as far as talking about the issue of YouTube channels and physicians, have you run into any problems with either administration of the hospital or patients with having a YouTube channel that features actual patient cases?
Patients, not any problems with that. You know, I always consent them. I ask them permission. I let them know it's going to be on YouTube, and I even offer to give them the website where it's going to be available for them to look at it and share or whatever. So I kind of keep a little bit of a relationship, let them know the video came out and stuff, so they can become involved in the process. Administration, initially they didn't have a problem. They did a little more research, and then they had me get a specific consent forms for the hospital so that if anything would happen during the procedure, they weren't liable for it by publishing it or whatever. So they have some consents that releases the hospital out of any indemnity or anything like that. But no problems. there's another channel, another physician, actually a professor of emergency medicine, College of Augusta, Georgia, Dr. Larry Mellick, and he has a very successful channel. He actually publishes his YouTube videos. They come in EM News, which is a big publication, comes out every month. And he'll do a lot of very sensitive material, very graphic material. I mean, he'll do thoracotomies, he'll do priapism reductions, I mean, everything. But he puts advices, and because it's through an educational facility, there's different kind of protections, and it's through the university website. So I guess that protects him from the video content, but he'll put the patient's face, he'll put the full dialogue. It's just everything's disclosed in those videos. I try to be a little more private. I try to only focus on the area of the problem and not include face or identifiers. Obviously, when something's near the face, then that's included, but the patient obviously knows the face is going to be included in the video. I've had a lot of comments from people, well, you're breaking HIPAA because you show the patient's face. And they just don't understand what HIPAA relates to. It's not to a procedure that you got consent and the patient agreed to share. It's something that I share without permission to the rest of the people that don't know about it, or if the patient does not know that the video is being shared. So that's the kind of stuff I've been battling at times or faced.
Yeah, I agree with you that HIPAA is about against the patient's consent, not when the patient actually signs a consent saying, yes, I agree to have the entire world see your procedure on me, or to, in our case, we actually do include stories along with it where the patient tells what's going on, which makes it a little more interesting as far as getting educated on procedure, to have an actual human story that goes along with it. That's in a little bit of context. But I see people doing it both ways that are out there. You mentioned Larry Mellick. There's a couple of other that I've enjoyed watching. I have seen some of Mellick's. I think I saw his thoracotomy and was quite amazed that someone was able to have a camera somewhere in that setting of the craziness of an open chest. But some of the other ones I've enjoyed are Dr. Paul Thomas in the Portland area, who's a pediatrician, has a great channel of cases. And he not only shows the entire patient and their face, but even family members on his. And then another one is John Gilmore, and he does very much limit his to just what's going on. He uses pseudonyms for every patient. And I think, are you familiar with Dr. John Gilmore?
I think so. I've seen a couple of stuff, I believe.
Okay, I get the feeling he's in Georgia and possibly Augusta. Are you in Georgia or are you in Florida?
I am in Georgia, northwest Georgia, I guess.
Okay, and did you used to be in Florida? Yeah.
I used to be in Tallahassee, Florida for about 5 years, almost 5 years ago.
Okay. Are there some other physicians on YouTube that you've either collaborated with or spoken with about putting patient cases on YouTube?
Yeah. I've done a couple of Google Hangouts with a guy named John Bennett, and he's basically a semi-retired from the clinical side and is trying to build up his channel by doing these collaboratives with other physicians, stuff like that. There I got to meet the founder of Real DX, but it's called Real, R-E-E-L, DX, and he'll publish little clinical vignette videos that other physicians post through his website. He approached me about using my videos on his channel. It's just it's a little cumbersome. He has a lot more consent forms, because if the video is a very successful video and he managed to sub-license it to an educational website or something, then that could be revenue streaming and things like that. So the consent forms are a lot more intense, if you will. There's a lot more paperwork to do if you want to submit a video to him, and I ended up not becoming so interested in all that work. I found out that the videos I put the most work in are the ones less viewed, and the ones that kind of very natural, very what I do without much editing, do the best. I guess people want reality, which I found out that some of the videos where the patient's in a lot of pain, or the patient says a cool story, or there's one video where the patient actually recited a poem at the very end, did the very best. They were just unusual, and people shared it, and how it's become viral or or got more views. I had this one video where this gentleman got a knife stuck in his hand, and you know, it's pretty graphic seeing it, but it ended up being a very minor injury. But what got people's attention is there's this kid in the background who's very characteristically, I don't know if I'll get in trouble for this, but redneck, and very loud and obnoxious, and that got a lot of comments, and the more people comment, the more the viral video kind of captures, and so that video did very, very well.
I know the video you're talking about, the knife sticking out of the hand with all of the wrapping around it that you had to take off.
Right.
And he's very much himself talking about how it happened and how they took care of it. In this YouTube physician-patient situation we find ourselves in, I'm sure you find the same thing, this finding that the videos that get lots of views tend to be a certain type, whereas what you're trying to accomplish as a physician may be a little different. And sometimes there's this feeling that if you're to pursue numbers or views, you would sort of be exploiting the patient, whereas what we really want to do is education, and that doesn't necessarily get as many views. Tell me about how you walk that tightrope between those two poles of being a doctor on YouTube.
Sure. I found out that there's exactly different kind of video for different populations. You know, I have 124,000 followers on the TheEDeXitVideo, but out of those, I can kind of tell there's about 2,000 that are true viewers, that fans that view everything I post. Minimum gets 2,000 views or something like that. This is the people that care about my channel, for what I'm trying to do. They watch even my personal stuff or whatnot. So kind of to answer your questions, how I started doing this, the reason I started posting these videos was to post exactly what you said about educational videos. So the purpose of it was to create a video that would summarize the diagnosis, treatment, outpatient follow-up, and when to return to the ER, so that if I'm discharging somebody from the ER with cholecystitis, I'm going to give them my speech, but it's not going to be nearly as good as pictures and narration and list in PowerPoint that has a voiceover. So my point was to create this videos to refer them back to the video so they could go home, watch it again, or watch it for the first time, you know, and have something to really follow on that. As I started posting, I found myself with need for footage, you know, to have a picture of a gallbladder, have a picture of an ultrasound, to have maybe the abdominal exam of a gallbladder pain kind of thing. So I started kind of grabbing those footage and asking permission so I don't have to buy the copyrights to use on those educational videos. And of course, I was doing an abscess treatment video. I grabbed the whole footage of an abscess video, mainly for the still pictures to use on my educational video, but posted the whole video. And that was the first video of mine that just really took off. And obviously I said, okay, there's people looking for the education part of it, but there's people who just want to watch the procedure. And what you said about just trying to target the video is that some people do want to watch the procedure, the abscess, the pus, and don't really care about the educations, the grossness. And you can see that because one video will have 100,000 views in a month or something like that. But how I try to make up for it is I always go back and either I talk a lot while I'm doing the procedure so I don't have to do much editing, or I'll go back and do a voiceover discussing the elements of the treatment that make that particular case different, or why I chose to do it this way, not the other, or, you know, I'll get comments on sterile technique, on cultures or no cultures, on why did I inject here, not there, why did I not sedate the patient. And so I'll try to answer those questions as I go through the video. That way there's a true educational component to the video and not just posting the procedure for the sake of views. Lately I've been challenged because some of the videos have gone truly viral, had 3 million views, 500,000 views, and even after years of being posted, they got flagged because they were inappropriate. And even though they have all this educational content attached to it, it was just maybe too graphic for it. And once it does that, it stops generating any kind of revenue towards the website, and the video becomes, the views just drop dramatically. So I went from an average of, for example, 2 or maybe 3 million views a month to maybe 1 million views a month. It's dropped about to to less than half of the total views I was getting daily, because some of those higher top videos have got flagged. And my lesson from that is that it's not an videos are not always green. They're gonna phase out. People are gonna stop watching because the people who are interested in the material is gonna fade out as they watch it once or twice. And second is eventually somebody is gonna be a troll and flag the video, or it's somebody's got, they didn't like something I said about it. And YouTube is pretty tight on not getting in trouble, I guess, and letting that flag stay. So I try to constantly post new materials in the hopes to make up for those views that I'm losing. But ultimately, does it really matter? No, obviously. I started doing the website, you know, to have the videos to support my TheEDExitVideo, which is a free website which basically collects all the videos I've either put together or collected over the internet. So not all my videos on TheEDExitVideo.com are mine. Some of them are links to other people's videos, like for example your channel, where if they would come to my website and type knee arthrocentesis and you have one of those videos, I've linked it, so you would still get the credit for that view, or the click view, what it's called, for that video, but they're watching it out of TheEDExitVideo. So it's a way to actually encourage views to other channels that are doing the same thing. And that's a completely free website. I got no revenue from it. The only thing is that it generates obviously the interest, the multiple views through my website, TheEDExitVideo.com. And so the point is, going back to the basics, is why am I doing this? Is ultimately patient education. Yeah, there's some element of, I diversified into nursing education, young resident education, paramedics, and do some videos specific to those groups, like when I do x-ray discussions, or I'll do a physical exam discussion, or I'll do my medical minutes, which are actually educational clips that we do in the ER during rounds before we start our shift. So I'll just record that and put it up for people to watch and learn from it. But that's like really towards medical professionals, not for the layman person. So I've diversified and done all kinds of things, and I found that by doing that, the channel has a little bit of everything for everybody. So somebody can find something to watch and enjoy and learn about it. A lot of pre-medical students and things like that that email me and send me messages. They just want advice and career choice and how to do this, how did you do that? And lately I've been posting a lot of those vlogs, kind of video responses to those comments, just because I'm kind of tired a little bit of doing the more time-consuming educational videos.
What has your experience been with the reception of the vlogs? Do you get views like you do for procedures, or is it a little less?
No, a lot less. Again, the people who watch the vlogs are the true fans, the people who actually care about the channel, or what me as a person, and not just the education, like want to learn how do I do things and how is my career and family life, and they actually care about more than just a simple procedure. Procedures, you'll see that some of them quickly get 10,000 views. Anything that gets more than 10,000, I consider that, okay, that was a successful video. But that got a lot of the people who are really not interested in the education. When I post something that says, you know, don't use this medication, and I get 3,000 views, those are people who are truly interested in the education part of it. And those are the people who are already my subscribers. I think that the initial hump in the amount of videos over 1 week is my fan base who watched it. And then you get the other ones that because they're searching for and finding, and then you'll see start tracking up, and then you'll grab let's say I posted a Zika virus when it was kind of just starting out. So that one had the quick hump, it lowered down in terms of views, and then as people start searching for it, it became more popular, so it comes up in the search results, and then now my video is actually doing a lot better, and it's had 50,000 views plus, because it's all about how many views it got initially, how it got ranked, how many comments, and that'll put you higher up in your search. And that's how a video becomes truly viewable by multiple people. Otherwise it gets knocked down the list, and it's hard for people to find. So until you have that group of subscribers that care about what you're doing, it's really hard to get that video that reaches that threshold where it's going to go viral, or it's going to get hundreds of views, thousands of views, or whatever.
How are your viewers communicating back with you? Are they doing it through YouTube comments, or through Twitter, or something else?
I try to do almost everything, but I would say mostly it's through the YouTube comment box. You know, I try to respond everything through there. Otherwise, it's just everywhere. Even when they send private messages, I hardly ever do that. So I'll see a kind of like a cool message or something informative or something, and I'll see it months later. You know, I've had people reach out to me because they're writing a project for school and they want permission to show my video as part of the project, and I respond months later saying, I didn't see this till today, you know, I'm sorry, but yeah, sure, go ahead and use it. I've had some people comment me that my videos have been viewed in nursing schools or medical school. One gentleman reached out to me and said that he's overseas, I think in Europe somewhere. He says that in this big, you know, medical school lecture, all of a sudden my video popped up and they was talking about cavernous sinus thrombosis. And he was just wanting to let me know. I'm like, wow, I'm an international professor now or whatever. So that was kind of cool. One of the pre-nursing medical assistants in the ER said, I was in my nursing school and they were showing a video about a chest tube, and a video started showing up and they started showing the procedure, and I'm like, wait, that's my doctor, I know him, you know. So it's kind of funny that now that I've had all this traction, all these views, some people actually recognize me. Some patients have said, I think I've seen your channel, I think I've seen your videos. And that's kind of funny because I've never seen them before. It's not like they came through and they heard about it or something like that. It's like truly they just saw it for whatever reason. And then they happen to know me, you know.
Wow, that's something that I would actually look forward to having happen. At this point, it's the, you know, as you said, the international audience. It's not so much the local. Of course, I'm not doing any promotion of it. Are you doing any sort of promotion for your channel at all?
No, I never really did. I guess what I try to do is in each video, you know, put a little clip, subscribe to me or visit my channel or do something like that. So it was thanks to those videos that did go viral that I've gotten all the subscribers and everything else. Maybe I've tried AdWords once or twice or some kind of website that increases your views, but it really is not worth the trouble. They're expensive, they're guaranteed a certain number of views, and it really doesn't turn into anything because whatever you put into it to get a couple views is not going to turn into subscribers necessarily. So what I've learned about all this is that it's better to have an organic growth, you know, that the few followers you have, they're truly vested in your content and they just want to see what you're doing. And they even like your accent or they like your way of editing the video, and you don't have to make it over the top or whatever. Obviously, there's a different kind of videos if you want to do like, I'm working with a company now that's got this collection. It's called Bioscape. So they're doing these tablets in the ER in every room, and the tablets have a bunch of functions, have games and patient feedback, and it's got a part where it's videos. And they've had hired doctors to be on these videos, but they only have like 30 or 40 different subjects. And that's one thing that I try to do with TheEDExitVideo.com. I basically made a list out of my discharge software of every single diagnosis. And either I made a video about that diagnosis or I found a video from somebody else and linked it. So one thing that I'm proud of is that if you go to TheEDExitVideo.com and you type in Kawasaki, you'll find a video about it. If you type in, you know, lumbar radiculopathy, something will come up. So basically anything that's related to ER diagnosis, there'll be something there that's being screened by me that has educational content and it's of value. And now this company only has like 30 videos, so now I'm working with them. Hey, why don't I make my videos available through your tablet? I'm not going to charge anything, or you know, whatever they want to do with the licensing or whatever, but so that they can have a true collection of ER diagnosis, not just 30. You know.
Are you giving them your videos, or are they actually going to be a link to your YouTube so you can still get some revenue from it?
I don't know how we're gonna work that up. We're currently talking about that. I mean, we might make our own video for that based on my previous script. We'll just redo them so that it's separate from what I do in YouTube. I've had companies reach out to me with permission to use my videos. And if it's like a hospital or a small clinic, I'll just say, just put the link up. It doesn't matter, because if the link is up and there's a click, if there's a revenue attached to it, it'll still come to you if it's linked. Now, if they download the video and repost it, then that's kind of cheating. They're stealing it. And if you have a successful video, you'll see people start posting it. I mean, my videos are reproduced 10, 20 times everywhere. I found them in many different places. I've gone through the trouble of reporting them through YouTube, but it's not worth it. It takes a long time, and you don't get anything from it other than the videos canceled from the other channel.
But even that would get rid of the diversion away from your channel if you're able to do that.
It would. The funny part is they don't go through the trouble of removing the little copyright sign, so it still kind of promotes my video when I say, hey, I'm Dr. Carlo with TheEDexitVideo. If you want to watch other videos, come here. They even leave that up, so it's fine, you know. Okay. I used to use the revenue generated. The whole thing I was using to reinvest into that website, TheEDexitVideo, because it's very expensive to get somebody to program these things. I mean, thousands and thousands of dollars. I'll probably put more than 50,000 into TheEDexitVideo with all the updates and the app and different things like that. But lately, I've just taken all of that money and making monthly and going towards charitable donations. So that way, I don't feel like I'm getting anything out of it personally. Just transferring over to mission trips or something. I'm going on a mission trip this summer, and I'm using the money generated by the videos to come up with the money and the medications and the instruments and everything else we're going to need on that trip.
Where are you going?
Honduras.
Honduras.
So hopefully we'll grab some good raw footage over there. I'm sure we'll have some cool stuff to share.
Well, send me some information about it if you need somebody with both emergency and family medicine experience.
Yeah, I'm sure. So, Dr. Vaughan, tell me about you. You're emergency medicine trained, but you're doing a family practice setting. How does that happen?
I did emergency medicine. In fact, I'm wearing my my ACEP pin I just got the other day here. Yeah, I keep up my certification through ABEM, and about 2 years into emergency medicine, left where I was working in the emergency department and went to work in urgent care / primary care. And what it got for me was a much lower income, but also weekends off and evenings off. And that was something I never wanted to give up, because my family lives on kind of a 9 to 5 Monday through Friday schedule, and it just worked out so much better for me. Plus the night shifts, you know, some people can adapt to it, and other people it just doesn't happen. I unfortunately was one of those people that the adaptation to the scheduling just never worked.
I guess that's what burns people out, that constant change in shift. Because being medical director of my facility, I get a little bit more control of the schedule. I never did because I didn't want to take advantage of the schedule in that way, so nobody could point fingers that I was picking up shifts. But my wife had a bad illness last year. Because of that, I had to take control of the schedule. I just had to do all the homework, all the picking up the kids during the weekdays, and I was working basically Thursday night, Friday night, Saturday night, being off the rest of the week except for meetings. Once she started driving and doing things, then I was able to start putting some day shifts here and there, and then night shift weekends. Day shift here and there, and then night shift weekends. And as she's gotten better, now I basically work every Monday 10 to 8 p.m., every Wednesday 6 to 4 p.m., about every other Friday day, and 1 weekend nights a month. So if I do that, that gives me about 12 shifts, and it's working out really well. For the first time, you know, I feel like I'm not always exhausted. I'm actually here with the family. I'm doing homework with the kids. I'm even coaching a little basketball league. It's on Tuesday afternoons, which is my administration day. So it's all meeting days, and then afternoons I'm off. And then Saturday mornings, unless I'm working nights, that's Friday night, I'm off as well. So it's given me more control. And my goal is, as other sources of income, if this TheEDexitVideo would develop into its own thing that could generate income, as maybe facilities, hospital, clinics use the videos to teach patients, and I would get some kind of income from that, is to kind of withdraw the number of shifts to allow me to do more of this other stuff that I do. That would be the ideal goal of what I'm doing.
You say other stuff that you do. It sounds like you have in mind some kind of a slightly different career in the future would be your ideal. What would that be?
I'm sorry, the computer's telling me that my memory is low. Let me save this here. So you asked what I want to do. No, I'm fine with what I'm doing now. I think I'm gonna keep doing this, like being director, doing my shifts and doing my videos here and there for the next 10 years. You know, as the children go into college and stuff and the money necessities go down, start going down on the number of shifts and increase the administrative duties. Right now I'm medical director of one facility, but opportunities have come to be supervising director of other facilities, but I've not taken those on because it would involve traveling 3 hours away, supervising an ER, coming back home, or staying overnight, and a lot of traveling. So it's not the right time to do anything like that. But as I withdraw from clinical work, we'll be increasing consultation work, or maybe a division director where you supervise other medical directors. And then you have to do a lot more travel and less clinical work. I think that my goal would be, you know, semi-retirement, 55 years old plus, is to be a consultant either for patient perception kind of thing with Studer Group or something like that, or I actually have an idea of being a productivity coach. In the emergency department, you know, you have to deal with so many things at once. You have to be organized. You have to have ways of doing so that you're truly productive. And I think that not being a better doctor or not being a better clinician than other doctors, I'm better at managing time and better managing patient flow than most. And that's why I'm director. And that's why I've gone up the ladder, if you will. So I think I'm good enough, that I've learned enough that I can take that and make it into a thing. And hopefully in the future, I'll be a consultant teaching other doctors, young doctors, how to become organized, how to move patients through a system, how to not get involved in ER cases when you can give them away to the consultant and move on. Because as much as we want to get involved, it's not our role as an ER doctor. You gotta move on to the next patient.
What do you see for the future of collaboration between physicians on YouTube? Do you have plans for that or ideas for what the future could hold?
Yeah, I mean, I think the more we encourage each other and the more we do this, the more good perception is going to have from the community that, you know, ER doctors are not on a silo and we're reachable, and obviously politicians, all kinds of people are doing this where they're reaching out to the public through media. My goal is more and more people do this. If I could convince 100 doctors to produce 3 videos each, you know, we could have a library of every single possible permutation of ER diagnosis, and we would do them over a short period of time, and we would have this library where we could all collaborate to create, and we all benefit from it, you know. So that would be the ideal thing. We could have specialists talking on that specific type of injury. If you have an orthopedic injury, you have orthopedics talking about it. If you had an OBGYN talking about ectopic pregnancy, you have a pediatrician talking about erythema multiformis. So if we could create that collaboration where each one works on 5 different videos and every year kind of makes a new update, how much easier would that be, and how big that library would be? That would be really awesome.
That sounds really
awesome. The other thing I'm thinking is, you know, hopefully people with other cultures and languages, so that you have the same content in Spanish and in French and in Japanese, so that if you have a patient come to your clinic and you want to tell them what, you know, onychomycosis stand for, you can play it on that language. That would be just superb if we could do something like that.
Have you started doing that in Spanish yourself?
I have, actually. If you go to TheEDExitVideo.com and on the search tab, there'll be a flag, then you can click Spanish, so the search results come in Spanish. So those videos are specifically in Spanish. You can still search for it in English, so if you type cholecystitis, the video for gallbladder infection in Spanish will come up. So you don't have to know the language. But I don't know how would that be. Obviously, the programming would be a lot more involved if it was Japanese or Arabian or French, because how do you search for it if you're different language? I know the language, so how could I create the tags and such? So my hope would be that eventually I would get a physician who could then recreate the video and double the audio, use the same video content, but double the audio, and create the tags, create the description. In that way, we would build up on multiple languages. So.
Okay. Well, I'll be sure to put a link to your channel in, actually it'd be over here, I guess. Depends on if this is mirror image or not. So that people who are watching this on my channel will be able to see your channel. And then I'm hoping that in the future we'll collaborate more and do another project together.
Yeah, we should. I just posted one on my video, on my channel, TheEDexitVideo, letting the people know that we're gonna have this collaboration. Stay tuned for this video. So I'm sure we'll be able to share and do this again maybe in another 3 or 4 weeks and come up with a different subject and go back and forth. It's be awesome. It's tons of fun.
Okay, thanks a lot. Thank you so much for doing this with us, and I look forward to doing it again.
Thank you, Dr. Vaughan. Take care.
Bye.